tell me a little bit about this award today and what it really means.
The American Heart Association came up with this award 2 years ago. This is the second year that it's been out, where they recognize emergency medical services, the EMS agencies, based on your performance with chest pain and heart attack care. Essentially, the core measures that we look at are every patient over the age of 18 receives a 12 lead, which is a specific procedure that we do on the ambulance, a 12 lead cardiac monitor test over the age of 18, non-traumatic chest pains. The second major measure is that from the time we get to the patient's side and check at patient to the time that they deliver the care to the cath lab, and the cath lab balloons and takes care of the STEMI, which is the kind of heart attack we're looking for, has to be under 90 minutes from the time of when we're at their residence, whether that would be in Delta County or Hopkins County or wherever that ambulance picks that person up.
So explain how you guys work together, and I'm having excruciating chest pain in the ambulance.
Sure, absolutely. What we do is we'd arrive at your home. We do early recognition and early 12-lead transmission, and we send that transmission through the ambulances to the hospital before we ever even leave the scene a lot of times. The cath lab gets notified of that. They actually receive that. I'll let Nolan talk about that a little bit. Once we recognize the cardiac problem and the chest pain with the 12 lead, then we'll transmit that whether we're on the way to the hospital, and then we have a certain protocol of medications that we give that helps with the heart attack. And once we arrive here at the hospital, then Nolan's team takes over the care of that patient because time is of the essence. We're trying to beat that 90-minute window.
Time is of the essence, and
yes, sir.
The way you guys work together with the equipment and everything.
Yes, sir. Basically what happens is when they transmit that EKG, well, then they page us out too. So it might be in the middle of the night, we're not here, but if they page us out and they're on their way, well, then we're on our way too. So generally we can meet that patient at the door or be here shortly after they arrive, and then we bring them straight to the lab, and the ER does a good job of taking care of them until we get here. And they give them some blood thinners and things to help stop the heart attack, and then we take them to the lab and we can open that vessel up and save that heart tissue from dying.
Still, from an age I can remember when it used to load them up and drive as fast as you could and just hope you got there in time. But it's a completely different situation now, obviously.
Yes, right now we have that way of early recognition and able to start the process of going before they ever get to the hospital. Previously, before it didn't really work that way. So
what kind of special equipment do you guys use to talk back and forth?
Well, we use the physio monitor, the LifePak 15 from Physio Control. That has a lot of capabilities in there, just besides just chest pain recognition and other software in it. That is our primary piece of equipment. We also have several communication devices on the ambulance that enable us to transmit that wirelessly, whether we're in the living room of the home or in the back of the ambulance. So having that technology is crucial to saving time and getting that patient here on time. There's a lot of moving pieces and parts to getting this whole process done and complete, to actually getting somebody at 3 o'clock in the morning from their couch to the cath lab and taken care of in under 90 minutes. So it's a great teamwork between the cath lab, the ER, and EMS, and we're very proud of the award and our cooperative partnership that we have.
Obviously, you're proud of the award.
Oh, absolutely. Yes, sir. It's really the transmitting the EKGs are a phenomenal thing. I get their EKG actually on my phone through an email.
Yeah.
And so we can look at the EKG. We know how serious it is at that point in time, and we can really take care of a patient and address it.
And you can communicate with the EMS. You can give them things that they can do to make it better when
they stay in constant contact with the ER as they're bringing the patient in, and then we're talking with our cardiologists as they're coming in as well. So we're all in contact.
And I'd say a very important piece of this is our teams meet quarterly with the cardiologist, and we discuss process improvements. This has been going on 2 to 3 years.
2 to 3 years, yeah.
So we're constantly working on how do we improve, how do we get better. Nothing's ever perfect, but of course that's what we strive for.
It should make people feel better that if you have this problem, your chances of survival much better than with the way things are
Sure.
set up.
Absolutely.
It's also one of the things where the public really needs to know that it's best if they're having chest pain and they're at home. It's best for them to call 911, not drive themselves. We still
Yeah.
have some people that do that, but the big thing is that we can detect it earlier if you call 911 and let the EMS get to you.
Yeah.
Because they have meds that can considerably start helping you stop that heart attack en route rather than you drive here and waste that little bit of time.
All right.
So, I mean, it's a great job if they can call 911. That's a big help.